Good morning, everyone. There are approximately 80 different types of sleep disorders. National Institute of Health estimates that roughly 30% of the general population complains of sleep disruption. We are going to talk how homeopathy can help. I am Amita from Nourish Doc, a platform for natural and holistic therapies. Presenting this topic, we have Dr. Sujata Naik, a classical homeopath of international repute with over 27 years of experience. Dr. Naik is a researcher, author of several books, as well as a practitioner. She has presented her research at the British Homeopathic Society and a lot of other international journals. Welcome, Dr. Naik.
Hello, Meeta. Great to be here on Nourish Doc. Thank you so much for inviting me.
Great. So let's get started with what exactly is insomnia and other sleep disorders.
Yes. Hello, everyone. All folks out in the US. Very good morning to all of you, and good evening to people in Asia, in India. Today is the Independence Day for Indians, all of us. And I hope and pray to the Almighty to free us from this pandemic now on this auspicious occasion. And may we all benefit from health and wellness through homeopathy. And thank you, Amita. And let me answer your first question. And this is, what is insomnia? Insomnia is a medical term for nothing but sleeplessness. And sleeplessness could be defined as difficulty in falling asleep, or difficulty in staying asleep, or difficulty in both. You could have difficulty in falling asleep and staying asleep as well. And the diagnostic criteria for insomnia in medical parlance would be that if you have a sleep disorder, if you have a problem with sleep for over more than a month, and that causes daytime distress. So if you're not been sleeping well and that is causing you distress during the daytime, it is affecting your day-to-day functioning, it is affecting your social and cognitive behavior, then it's time to see the doctor for your sleep disorder. And sometimes even when the atmosphere is conducive to sleep and you're not able to fall asleep, that is true insomnia. So when you have the opportunity and you have the environment which is conducive and you're not able to sleep, that is insomnia, and that needs to be treated. So that in a nutshell would be insomnia.
So a lot of people right now, all of us are anxious and stressed out and having some kind of a sleep disruption. So how would you say, what kind of, do we have insomnia or we don't have insomnia?
Very true, Amita. That's a very relevant question. We all are having disruption of sleep. Many of us are suffering from that, but this could be circumstantial, as I'll be coming to the types of insomnia. And the first in the definition of insomnia, the first category is the acute insomnia, which is also the circumstantial insomnia, which could be associated with the COVID times today. And a lot of people are complaining of sleep disorders these days. Whether the COVID infection itself is associated with sleep or psychological issues remains to be seen, because long-term studies will have to be done to prove that. However, the fear and the anxiety associated with the COVID pandemic itself is causing sleep disorders, especially difficulty in falling asleep or disturbed sleep. And we will definitely need to tackle that. And there are a lot of doctors who are coming out and observing that there are more and more people now coming forward to complain about sleep disorders, and there are a lot of prescription medicines being handed over, which almost 40 to 50% rise in sleep disorders, and this is quite significant. So you could call it insomnia, definitely, but it's not a long-term insomnia. Some people, it could be long-term, who have underlying sleep issues from the beginning, and the COVID pandemic is only kind of compounding them. So insomnia is something which is, it's a very subjective term though. A lot of people will say, oh, I suffer from insomnia, when they perhaps may not realize it, that they're actually sleeping and maybe just dreaming very vividly and thinking they'd not slept through the night. But all in all, insomnia being a very subjective condition, if the person complains of sleep disturbance or complains of not having slept well, then that should be taken as insomnia. So the types of insomnia, as I said, acute circumstantial insomnia, which most of us are experiencing today. There is something called as chronic insomnia, which is secondary to certain medical conditions. For example, diabetes and hypertension, metabolic disorders, cardiovascular issues, people with chronic pains related to arthritis or autoimmune conditions, the elderly, who would have a problem with getting to sleep. Addiction and substance abuse, that is one more factor. These are some of the conditions that could lead to chronic insomnia. And people who travel through different time zones, they again have a problem. So this is a condition which is generally associated with something like some comorbidity. So this is also called as a comorbid insomnia. And the third category is known as a primary insomnia, that is insomnia, sleeplessness without a cause. There is simply no cause. A person is healthy, otherwise does not have any risk factors, is not under undue stress. Like in chronic insomnia, high stress or prolonged continuous stress can also lead to sleep disorders. But in primary insomnia, it's not necessarily associated with a well-defined condition, and the person may just be sleepless or have difficulty in going to sleep, or may just wake up much earlier than usual, or earlier than normal, and have difficulty in going back to sleep. That could be a type of primary insomnia. And here, homeopathy definitely has a very, very good answer. We'll come to that eventually. But this is just in a nutshell the types of insomnia that we generally encounter in clinical practice.
Okay, so let's talk about risk factors.
Yes, as I earlier also mentioned, that the causative or the predisposing factors for insomnia or sleep disorders would be, generally in women, we see insomnia is more common in women for some reason or the other. And a hormonal imbalance is generally one of the main causes for insomnia. So women, especially change of hormones, so whether it's puberty, pregnancy, or menopause, would have some changes in their sleep pattern. And why this happens is sometimes very difficult to say, but it probably plays the PNEI axis, as we say, that could be responsible, that could be having an effect on the hormones, especially the estrogen and the progesterone. If there's an imbalance in that, that could cause a difference in the thyroid function as well, which again could lead to increased cortisol levels, stress, and that could be one of the reasons for insomnia. In the elderly, as I mentioned earlier, that people above 60, 65, almost say after 70, as we say that sometimes the need for sleep goes down. So the elderly often say that, oh, I don't need to sleep that much. But recent studies by sleep experts have shown that even the elderly need about 7 to 8 hours of good sleep. And sometimes they may not have that. And the reasons could be as simple as they may not be physically as active as they were earlier, or they could be on certain medication which might be hampering the sleep, or loneliness and other psychological factors could be one of the reasons. Poor health, poor eating habits, poor factors regarding their lifestyle, regarding their mode of living, their conditions of living. These are also some of the factors that may be leading to a certain amount of stress which the elderly face. Anxiety is one factor which a lot of elderly do face. The anxiety of being left alone, of illness, of being forsaken. These are some of the anxieties they face, and those could be the predisposing factors for insomnia. High levels of stress, of course, as we know that stress is the underlying factor for most problems, and especially for sleep. Sleep being one of the most vital necessities of human health, along with nutrition, along with water intake. Sleep is one of the most vital factors and one of the most important necessities to maintain human health. And if there is an ongoing stress, a prolonged stress which an individual faces over a period of time, which he's not able to deal with, then in that, especially people who have been ill, chronic illness could be one factor for stress, or financial issues which have been going on for a long time. Those can affect the person to a great degree, or interpersonal relationships leading to stress. These are some of the factors that could lead to sleep disorders. Again, traveling to different time zones, as I mentioned, people who are all the time, especially people working in the airlines or people in businesses which requires them to travel very often against different time zones. So one day you're in Asia, another day you're in Europe, and maybe the US, and then you have to go to another part of Asia, or the entire, or it could be just anywhere. And when they travel from, especially from east to west and west to east, there's absolutely opposite time zones, then they have a lot of problem. And if you're not acclimatized properly, if you don't give your body enough time to rest, if you don't give your body some sufficient time to get over the jet lag, then you're in for long-term sleep issues, and they can affect your health in a very, very great way. So traveling against time zones can affect your circadian rhythm to a great extent. It can actually put your entire biorhythm in totally out of gear. And that can lead to deficient chemicals which are important in the brain, It can lead to a hormonal imbalance. It can lead to increased cortisol levels, increasing your blood pressure. It can cause something known as the metabolic syndrome. So sleep in a way is actually affecting your entire body. And a good sleep, well-balanced sleep can balance your entire equilibrium, the physiology of the body markedly. So as they say that a good laughter and good sleep is very, very essential for good health. And this is people who are pushing themselves all the time, being ambitious and trying to put back in too much in too little time, often suffer from sleep disorders. And then you have prescription drugs which don't really help you in the long run, affecting your cognitive function and affecting your quality of life in general. The next one is the sedentary lifestyle. We know that lifestyle has a very, very big role to play in sleep. So much of screen time nowadays, especially in COVID times, that is one of the reasons why a lot of people have been experiencing sleep disorders, because our screen time has increased markedly. So much of screen time, artificial light, irregular hours of sleep, sleeping very, very late, getting up late. So your entire rhythm completely goes for a toss. So if you're not having enough physical exercise and being sedentary all day, even people who generally go to the gyms and work it out for 2 or 3 hours, and then the rest of the time they're on their chair, often have this problem because they think that they've been exercising, but unless you've been physically active all the time, your body is not going to burn those calories. It is not going to, your physiology is going to get disturbed, and your entire circadian rhythm is going to go into a disarray. And then these sleep disorders can set in. Again, work shifts, people working in night shifts, or people working 2 days day and then one night and then 2 days, this kind of thing, factory workers, and even doctors and paramedical staff working in hospitals in day-night shifts often have this problem. So they need to really set their biological clock very well. And there are ways and means we can definitely talk about how to get over these issues if time permits. But they really need some special counseling. People who work against time zones and working in different shifts need special counseling by sleep experts, how to manage their sleep and how to manage their diet and their rest hours, depending upon the kind of work they do. Stimulants and addictions, as I mentioned earlier, smoking, drinking, substance abuse can affect your sleep very, very badly. So in small quantities, alcohol can be a soporific. In large amounts, it can actually depress the central nervous system, causing sleep issues, causing sleep disorders, daytime sleepiness, and extreme lethargy during the day, and then alertness towards evening. So this is one factor. People in the lower socioeconomic strata often have other issues because they have a lot of stress in day-to-day living. They could also suffer from sleep problems and poor sleep habits. As I said, that the modern times, the COVID times has really changed things for us. While for some people, it has been beneficial because they are not going out anymore. So they're sleeping on time, getting up on time, eating well-balanced meals. But some people now, the only window to the outside world is virtual. So they're all the time on their tablets, on their cell phones, and on their laptops, and the electronic media, the digital media is not really doing anything good for your sleep. So these are the factors that really need to be kept under control if you want to not suffer from insomnia and have a good balanced sleep, and then definitely then enjoy good health.
Okay, so I think the sleep, we um, talk about what are the effects, if we are all deprived of sleep. A lot of issues, problems that I see over here, which is very scary. So maybe you could explain it a little bit.
Yes, and the risk, the ill effects of sleep deprivation, you all know, most of us know, and we're afraid of that. So we try to get as much sleep as we can. The quality of sleep, Amita, is very, very important. It's not the number of hours. And unfortunately, people think that, okay, if I go to sleep at 2 a.m. and if I get up at 9 a.m. or 10 a.m., then I have completed my 7 hours of sleep. And why is it that then I'm not feeling up to the mark? Why is it that I feel dull and tired when I wake up and not feel refreshed? So it isn't about the number of hours, but the quality of sleep is very, very important. Generally between 2 a.m. and 3 a.m. is the time, between 3 to 4 a.m. That's the time when the body goes into something known as the REM sleep, where all the repair work is happening. And the body is trying to heal itself. That's when all the wear and tear is thrown off. The body is rebuilding its tissues. There is healing happening. And if you're going to be awake at that time, if you're not been sleeping at that time, then definitely the healing is not going to take place. And you are going to be, your immunity is going to get weak. And with that will come a host of disorders. So the ill effects of sleep deprivation, of course, because it affects your cognitive function, because you're drowsy through the day. And people who take prescription medicines often suffer from this. So they might sleep through the night, but they're often groggy and uh, very unfocused through the day. So that can lead to accidents. Again, sleep deprivation and sleep issues can lead to something known as acidity. A lot of people have hyperacidity issues. They have a heartburn, which is generally related to something called as the gastroesophageal reflux disease. So they have this burning sensation in the epigastrium going up to the food pipe, and a very burning, bitter kind of bile taste in the mouth, and which affects their appetite, which affects their digestion, which affects their mood. Then, of course, the most obvious cause is on the psychology, on your mental state. So if you've been, people can do without food for as much as 72 hours, but you cannot be normal beyond 72 hours if you're sleep deprived. So mental diseases like depression and bipolar disorders, low moods, low spiritedness, these are some of the most obvious fallouts of sleep deprivation. Let me also tell you that some of the mental disorders like schizophrenia and bipolar disorder, these itself may prone or predispose the person to sleep issues, may predispose the person to insomnia. So when a person complains of rather he's brought to you for by the loved ones or the family, saying that this person, my brother or my son or my daughter hasn't been sleeping for weeks together, and you find any kind of a problem with behavioral issues, then you can definitely want to rule out mental conditions like schizophrenia and bipolar disorder. So it works both ways. Like sleep deprivation can lead to mental disorders, and mental disorders themselves could be precursors to insomnia. Of course, as I mentioned earlier, weakened immune system. So if you're not been sleeping well, your entire physiology goes into a disarray. Obesity. This is one of the most common fallouts, one of the most complications of sleep deprivation. And this is because leptin and ghrelin, which are the two most important hormones, which are produced by the liver, which are, one is the hunger hormone and the other is the satiety hormone. And there's a confusion between them if you're not been sleeping well. So the liver gets confused. So a person who has not been sleeping well generally complains of too much hunger during the day, which is not really hunger, but an unnatural increase in appetite, which could be related to the sleep deprivation. So there are cravings for sweets. There could be cravings for certain substance abuse becomes very common also in people who have not been sleeping well. So they generally tend to go towards more alcohol or tend to smoke more when they're sleep deprived. So obesity can happen, especially central obesity. So in men, it's generally the apple-shaped obesity. In women, it could be the pear obesity, which could be one of the fallouts of sleep deprivation. Again, the metabolic syndrome, as I said, hypertension, obesity, type 2 diabetes, thyroid disorders, cardiovascular issues are generally a fallout of sleep deprivation. So hypertension, high blood pressure, heart disease, and type 2 diabetes come under a condition called as a metabolic syndrome. And this can be one of the effects of sleep deprivation. Again, hormonal disorders. Hormonal disorders work both ways. Hormonal disorders themselves can lead to insomnia. So a woman who undergoes menopause in the perimenopausal zone, she may be, because of her changed hormones, she may be prone to insomnia. The insomnia itself may predispose her to further hormonal imbalance, making it a vicious cycle. So for the doctor who's treating the person needs to handle both these things. So it should be not one in lieu of the other. Both must get better simultaneously. Her hormonal imbalance must be restored and her sleep must get better. And cognitive function is one of the most common things that gets compromised when sleep deprivation happens. And this leads to memory disorders. So persons often complain of poor memory. Oh, I've forgotten what I've done. There is lack of focus, lack of concentration. And this is all because confusion. These are some of the most common symptoms of a person who has not slept well. And if it is circumstantial, as we said in acute cases, if it is circumstantial, like you just undergone a stress, too much of work at office, a lot of physical exertion, mental exertion, exam stress. So this could be just related to that event or that circumstance in your life. And once that is restored, once things come back to normal, your sleep also comes back to normal. And the temporary confusion and the memory impairment that you face might also get restored. However, if this continues on a long term, if it's a prolonged issue, chronic stress, chronic grief, chronic issues with the patient, chronic health issues, a lot of people with autoimmune disorders or chronic health problems are on medication. Some of the medication itself could lead to sleep deprivation. Some immunosuppressive drugs, these all come, they are double-edged swords. They come with their own pack of side effects. And one of the side effects could be insomnia. So this in short could be the ill-effect.
So do you want to brush on some other sleep disorders real quick on these as well?
Yes. As we said, insomnia is the main thing today, but we have other sleep disorders which are associated with sleep problems. And one of the most common and one of the biggest matters of concern today for all specialties and respiratory disease specialists, cardiovascular specialists, physicians is obstructive sleep apnea. You must have heard this term very often nowadays. And in short, for the common person, it could be something like snoring. And people laugh at snorers, and wives often complain, oh, my husband snores like a engine and I'm not able to. It's like an engine, so it's like a whistle which blows for some time, then it stops, and then he whistles again, and then it stops. But believe me, this is nothing to laugh about, because this could be a very, very serious disorder. And obstructive sleep apnea is when there is a temporary stoppage, temporary hindrance to respiration, because the muscles in your mouth and the hind part of the mouth sometimes relax too much. There's contraction and relaxation. And when it relaxes too much, it could cause a hindrance to the air passage. And sometimes, in a person with poor cardiovascular health or an underlying heart issue, the heart can actually stop for a few seconds, and it may result in something known as a myocardial infarction. It could result in a brain stroke. So a sleep apnea should never be taken lightly. You must go to a sleep specialist, get yourself diagnosed, see what can be done, treat the underlying disorder. A lot of obese people who have been obese due to lifestyle issues and have central obesity often have a sleep apnea because of the problem with the diaphragm. So when there's a lot of obesity in the abdomen, the diaphragm can get a little constricted, and that can actually press on the thorax, causing difficulty in breathing. So these are some of the issues. Some people have chronic sinus problems leading to sleep apnea, or a mechanical issue like a deviated nasal septum, which itself could cause obstruction. But obstructive sleep apnea is generally related to lifestyle disorders, and correction of the lifestyle often can correct the problem. Sometimes it may not. And if it doesn't, then there is something called a CPAP machine, which will help the person to breathe better. But obviously, we'll have to do it under a sleep specialist guidance. So if you have any of these symptoms, then please consult your physician ASAP. There is something known as restless leg syndrome. And this is again a very, very common problem these days, something which can really disturb you, but not so bad that you need to go and see the doctor for it. A lot of patients come to us saying that they have some strange sensation in the lower limbs when they are lying down at night, a kind of pulling sensation, a kind of spasm. It's not really a pain, but a pulling sensation, as if there's no life in the limbs, or they need to press it hard, or they need to just walk around to feel better. So this is known as a restless leg syndrome, and the cause is still not very well defined. However, there is some hypothesis about it. Some doctors say it could be because of vitamin B12 deficiency. It could be a deficiency of magnesium in your diet. It could be potassium, or it could be iron, calcium. So some of the deficiencies of these vital important minerals could also lead to restless leg syndrome. Administering these vitamins, if there's a deficiency, can alter it, can help the patient. Sometimes it does not. Even when these factors are corrected, the dietary factors are corrected, even then a person can still suffer from this. And this sometimes is a big headache, both to the patient and to the physician, because it can actually disturb sleep in a very, very big way. And a lot of menopausal, perimenopausal women have been complaining to us that this is the problem that we face. And we just need to, every couple of hours, I need to get up, walk around in the room, and then go back to sleep. So it disturbs my sleep profoundly. And of course, if they see a homeopath, probably something can be done about it. We can come to it later. There's another factor called as sleep bruxism. Bruxism is nothing but clenching or grinding of teeth at night during sleep. Several people, again, of course, the person who does it may not even know that he's doing it, but the partner, the spouse, or the family member often notices. A mother might notice her teenage son clenching or grinding his teeth at night. She just hears it and she goes and sees that he's clenching away, grinding his teeth, and there's a lot of grating sound that comes to it. It by itself, it's not a very serious condition, but if it's very bad, then it can actually damage your teeth. So you need to sometimes use the mouth guard for that. Or if it is because of some psychological issue like anxiety or stress, especially in teenagers or in children who are very, very sensitive, homeopathy is the answer, because we have a lot of remedies for bruxism, for clenching or grinding of teeth at night. Sometimes children who have worms also have grinding of teeth. Uh, that could be one of the underlying causes, but that needs to be diagnosed. So after which you can give a specific remedy for the worms, and that should solve the problem. And as we spoke earlier, any disturbance in the circadian rhythm will cause sleep disorders, because the sleep-wake cycle gets disturbed. And as we mentioned earlier, in the shift workers, day-night workers, they often suffer from this, and they really need counseling on how to manage their diet and their sleep pattern. Yes, and the last two sleep disorders, very common, not so serious, but can be very, very distressing to the person who suffers from them and from the family members. One is somniloquy, and that is known as talking during sleep. A lot of people have this problem. Either they talk during sleep or they walk during sleep. So sleepwalkers are also common, and sleep talkers are also common. Sleep talkers generally mumble something without understanding. They just get up and speak for a few seconds. It could be completely irrelevant. There are people giving entire lectures during sleep. Some people may just get up and walk. A sleepwalker sometimes may not actually walk. He might just go to the door, come back. He may sit up with a very glazed look in his eyes. So he's not actually, he's seeing but not seeing, because he's still in sleep, but he doesn't know what he's doing. It's not really a very dangerous condition, but if it happens where a person might inflict, if you think that there is some kind of self-infliction happening there, then he needs counseling. It could be an underlying anxiety or stress. It could be a serious personality disorder also. Very often, though majorly it's not a big issue, and just merely allowing the person going back to sleep on his own generally settles it. You should not wake the person, because then he can get a little violent at that time. Sometimes it happens during the REM sleep, which is a very, very deep sleep, or in the third part of the non-REM sleep. And that can also affect the person's cognitive function at that time. So the best thing is to just allow the person, take the person back gently to bed, and allow the person to sleep on his own. So these are some of the sleep disorders which we often encounter in practice, and which, though many of them not serious, but need to be tackled as well.
All right, so let's come to homeopathy. How can homeopathy help?
Yes, Amita. So we've seen what insomnia is, what the risks involved in insomnia, what are the ill effects of sleep disorders and the other sleep disorders apart from insomnia. So very often we've seen that conventional medicine, prescription medicines, whether they're anxiolytics or tranquilizers or sedatives, though effective, but comes with a lot of baggage of side effects. Very often, the most important side effect being sometimes daytime drowsiness, grogginess, this decrease in cognitive function, especially if they're taking strong sedatives. Focusing becomes a problem. Sometimes concentration is an issue. So until it becomes absolutely mandatory, when none of the remedies are working, nothing is helping, only then should a person resort to prescription medicine, because then it means that it could be habit forming. He might have to take it for life. Some of them are also hepatotoxic. They may affect the liver. And after some time, they just cease to benefit the patient. So for example, he starts in a small dose of a tranquilizer, and it helps him for some time. It works magically. And after some time, to get the same effect, the patient needs to take a higher and higher dose of the same medicine, until such time that it just ceases to have any effect on him. But withdrawal of the medicine can cause serious side effects. So it's a catch-22 situation for the patient. Here, homeopathy has a lot to offer, because homeopathy doesn't treat the effect. It treats the cause. It treats the man with his sleep disorders. So and it's most important, it treats the root cause. It has a holistic approach. It is derived from absolutely natural sources, whether it's plants, minerals, or animal products. It is a highly diluted and highly potentized extracts of natural minerals or plants, and in a very specific way on homeopathic principles. When the substance is diluted and potentized, it has tremendous therapeutic benefits. So a substance in large quantities, which could be toxic, which could be poisonous, when it is potentized homeopathically, has tremendous therapeutic benefits. For example, a drug called the arsenic album, which we've all heard of in COVID times, which has been given as a prophylaxis, as an immune booster for COVID, is in its raw form highly toxic. Uh, just a pinch of arsenic can kill the person. But a homeopathic extract of arsenic, which is diluted 1,000, 10,000, 1,000,000 times, where there's hardly any trace of arsenic left in the medicine, but the resulting solution which is there has tremendous medicinal benefits, and it can actually treat all the symptoms that an arsenic poisoning can produce, or symptoms which resemble those of arsenic poisoning. That is why it has helped so much in COVID. Similarly, there's a remedy in homeopathy called as coffea, which is derived from coffee. So we know that when you have large doses of coffee at bedtime, we are unable to sleep because coffee actually affects the central nervous system and it is a stimulant. But the homeopathic coffea, which is derived from coffee, will treat all the symptoms of insomnia, which were as if a person has had large doses of coffee. So when you say to homeopath that, oh, I am not able to sleep, as if I've had a stimulant, as if I had coffee, as if I've had tea, as if I have had large doses of alcohol, but I have not had anything and yet I'm not able to sleep. So that's where coffee can actually help. So we'll come to the specific remedies, but this is how homeopathy works. It treats insomnia as a part of the patient's constitution, and hence the treatment is individualistic. So what is given to one patient need not uh, work for the other person for similar kind of issues unless he has absolutely identical symptoms. So it's a highly customized, tailored dose. Homeopathic remedies are not habit forming because they don't work like the pharmacological treatments or prescriptions given by conventional doctors. Though the way insomnia is handled by homeopath would be very similar. I mean, the diagnosis, the examination would be very similar to that what a conventional doctor would do. But the approach to the patient is entirely different. It is entirely patient-centric and not disease-centric. So homeopathic remedies which are found useful in treatment of sleep disorders are aconite. Some of them, of course, we have more than 3,000 remedies, and every remedy from the Materia Medica, if it is constitutionally indicated, could work for insomnia if it matches the patient's personality. However, some of the remedies which are found to be very useful for sleep disorders are aconite, nux vomica, cocculus, gelsemium, coffea cruda, ignatia, pulsatilla, califos, and arsenic album. Of course, there are several more. You have argentum nitricum, and then you have passiflora, you have opium. Now, opium, don't get frightened by the name. We are not giving any opioids or narcotics in homeopathy. It is an extract of opium which is diluted to 10,000, 1,000,000th time, and so there is no trace of opium in it, but the way it is potentized and the molecular energy that is generated is the therapeutic power of the homeopathic medicine. So just to give an example, an aconite personality, who would require aconite and who would it benefit? A person who has gone through extreme fright. He's seen a murder, he's seen something, there has been, or a frightful event. He's been through something which is of very acute nature, and there is extreme fear. The person who experiences this is so frightful that he might even develop a fear, and he develops acute insomnia. The person is not able to sleep. So this is where aconite can actually help. Then the second remedy is nux vomica. Nux vomica is for the modern upwardly mobile guy who is older, working at his computer throughout the day, has no time to eat, no time to rest, will be eating at odd hours. He gets free in the evening after office, so he goes to the bar, has a couple of pegs of whiskey, then comes home, and he's been very, very irritable through the day because he's had a tiff with his boss. He shouts at his secretary. He comes home, and then he's all tired and yet not able to sleep. So he's very tired mentally. Physically, he's probably not really been very active. He sat in his chair the whole day. And this is what leads to the nux vomica personality. And nux vomica has often helped the type A personalities. The third remedy here is cocculus. This remedy is for the caregivers. So people who are often nursing their sick ones. Again, a very, very useful remedy in COVID times. The spouse or the partner or the family member is down with COVID, and the person at home is either looking after during the recovery or worrying about the patient all the time. How is my wife or my husband going to go through this, and doing everything for him or her. And in the process, then becomes very fatigued. At the end of it, is not able to sleep. The cocculus is one of the very, very good, important remedies. A remedy called gelsemium is also very important in COVID sleeplessness. Here, my neighbor has fallen sick. There is somebody in my building, somebody in my neighborhood who has tested positive for COVID. So now I'm scared. Will it come to me? And I'm not able to sleep. Your gelsemium is one of the very, very important remedies. So we have hundreds of such remedies, Amita, and the list is so exhaustive that it would be difficult to enumerate a lot of them. But I would like to present a couple of cases, just narrate a couple of cases where homeopathy has been very useful. So this is about one of my patients who presented in a clinic, case around 52-year-old man, complaining of digestion issues. And he had a lot of flatulence, gas, acidity, reflux issues, and bloating of the abdomen. And he said, I'm a case of irritable bowel syndrome and nothing is helping me. And I'm all the time suffering from gas. I'm all the time suffering from reflux. I'm not able to sit. I'm not able to lie down. And because of this, I'm not able to sleep. So when we took his history, we found that he was an executive in a firm, uh, a place of high responsibility, but he was not able to handle those responsibilities now. And he had become extremely irritable. He had become extremely, there was a lot of anxiety. There was a lot of an anticipatory anxiety. He had lost confidence in himself because he was denied a promotion, which he was actually due for. And that led to the whole story. So there was a digestion issue to begin with, but that got compounded when when the anxiety set in, when his confidence went down. And he would come home, and then because he could not revert, he could not answer his boss, he could not get back to his boss for fear of being fired, for fear of being ostracized. So he would come home and then vent out all his anger with his family members. So this was very, very typical of a remedy called lycopodium. And we gave lycopodium as, again, though not really a sleep remedy, but it is a constitutional remedy, and it can help a person to a great degree when he comes with these kind of issues and when he has this kind of a personality. A lycopodium person is extremely timid outwardly, but when he goes on stage and he has to give a speech, he can do it. But he, on a one-to-one basis, sometimes he has difficulty in maintaining relationships. So when we gave this patient lycopodium for some time, after a week or 10 days, we started noticing the change, because he said that now I'm sleeping better. I'm sleeping for 6 hours, which I've never slept before. I used to get up every 1 hour. I had to go to the washroom, and I would have difficulty in going back to sleep, and I would be very irritable throughout the day. And I think now I'm sleeping better. And because I'm sleeping better, I think my digestion issues are also a little better. So all in all, with the cascading effects that lycopodium brought into his constitution, we found that he got better on all fronts. His IBS was controlled to a great extent. His bowels were much better now. He was calmer. He was able to deal. Of course, no remedy can actually change the situation around you. But homeopathy, the correct homeopathic remedy, can help you to deal with the situation much better. So the problem remaining where it was with his boss, but he was now able to deal with it much better. So lycopodium was his remedy. So this is how homeopathy works. It works on all fronts. It has a very holistic approach. So it looks at the man in disease and not disease in man. So if you came with a sleep issue, or you came with a sinusitis, or you came with an arthritis, our approach should be entirely holistic. It would look at the entire man, his entire constitution, his predisposition, what has been his past medical history, what has been his mental state through the years. So all these factors are very, very important when you choose a remedy. And that is why it's a customized remedy. Lycopodium, is, as I said, is not a sedative nor a tranquilizer. Lycopodium can be given to another person for a recurrent cold. It can be given to another for asthma. It can be given to another patient with headache, provided his constitution matches that of lycopodium. So homeopathic remedy is about the constitution of the patient. Similarly, there's one more patient I would like to narrate about is a woman who was in her 5th month of pregnancy started complaining of sleep disorders. A very mild and very simple, happy-go-lucky woman suddenly started getting anxious. Will I have a normal pregnancy? Will my child be born without defects? What will happen? Who will look after me? I want somebody around me all the time. And she was living in a city, and her parents were living. She was living abroad. I think her parents living in India. So, and her mother was not able to reach her for some time, so she wanted a mother all the time. So this kind of constitution matched that of a homeopathic remedy called pulsatilla. Pulsatilla is very typical. A person with low confidence wants somebody around all the time, wants to be sympathized with, wants to be uh, pampered all the time, needs attention all the time. So, and very otherwise very mild and amiable. So pulsatilla was given to her and her problem was solved within no time. And she did not need to, or rather because she was not advised not to take any sleep medication during pregnancy, and she was highly distressed because of that. Homeopathy gave her a lot of relief. So this is how homeopathy can work in any situation. And you must, anybody having any kind of sleep disorders, do try homeopathy before you go for your prescription medicines. Because once you are on sedatives or tranquilizers, it may be difficult to withdraw if they have become habit forming. And even doctors don't like to give them just like that. But if it is affecting the patient's health, if it is affecting his equilibrium and his mood, then sometimes these prescriptions have to be handed over. But before that, we must try all the options. If it is related to your lifestyle, you must correct that. If it is related to your sleep habits, you must correct those. If it is related to a diet, then that needs to be corrected. Any deficiencies, please make sure that those are corrected as well. And take homeopathy whenever you have any such issues. Now, what are the good sleep habits? Very often, as we mentioned, that sometimes insomnia is related to some issue or the other. It could be a secondary thing. As I said, it could be a comorbid condition. And we must try and tackle the root cause of the sleep disorder. And how do you then have a good sleep? If you've been sleeping well and you want to continue to sleep well until your old age and not have any problems associated with sleep, then you must have a healthy diet to begin with. What does a healthy diet mean? A healthy diet is not a fat diet. A diet which is balanced in carbohydrates, fats, proteins, in all minerals, is has enough of protein, has enough of greens, and has enough of cereal as well. So a lot of people we have seen who go on fat diets or who go on crash diets, especially those on keto diets where carbohydrates are completely eliminated, often suffer from sleep disorders. And when they suffer from sleep disorders, it affects their skin, affects their hair, it could even affect their liver. So before you go on any specialized diets, make sure that you do it with consultation of your doctor and don't go on any kind of diets on your own. So healthy diet is the precursor. I often recommend a rice diet at night, say 3-4 hours before your bedtime. So something to do with rice. You don't have to have it in large quantities, but rice has an amino acid called as tryptophan, and tryptophan has a soporific effect because it actually increases the melatonin, which is the sleep hormone. So having a bit of a kind of rice diet. In Indian food, you can try the khichdi. Khichdi is a very, very wholesome meal which has rice and lentils or rice and dal in it with a lot of vegetables. And that could be a complete one dish meal, very healthy, very easy to make. And if you have a little bit of khichdi at night, about 3 or 4 hours before bedtime, I'm sure it will help you to sleep better. So healthy diet is the crux of the matter actually. Regular exercise, of course, is a must. Just gymming and pumping iron for 2 hours is not going to help if you're going to be sitting all for the rest of the 22 hours. So regular exercise, get up, even if you're at your desk, if you're working all the time on your laptop or on your tablet, make sure that every 15-20 minutes you just get up and sit down, even if you cannot, don't have time to do anything else. Or just take a round, do some stretching. Don't just sit in one place, because that sedentary lifestyle is one of the biggest problems for cardiovascular illnesses. And the sitting disease, as they say, is as bad as having diabetes or hypertension or other issues. So, and that itself can lead to sleep problems and again predispose you to cardiovascular issues. You must have a consistent sleep and wake time. So very often people who sleep for number of hours of sleep that they get is adequate perhaps, but the sleep times and their wake times are extremely irregular. So no matter whatever happens, try and get into a regular pattern of sleep. So even if you sleep at midnight, suppose, and if you get up at 7 a.m., try to keep it at that. Getting into bed at 11 p.m. one night and then getting into bed the next day at 2 a.m. and then trying to see that you're completing the number of hours is no good, because that is disturbing your circadian rhythm. It is confusing your body because it does not know when to start repairing, when to start becoming active. And these are very, very essential things when it comes to your health. Of course, avoid or limit stimulants, absolute no stimulants towards late evenings. Avoid beverages like tea, coffee, avoid alcohol towards late evening, because that can again hamper your sleep. Right. Reduce screen time, as we know. Try and listen to soft, relaxing
Your
music.
voice says,
Is my voice
Dr.
breaking?
Naik?
Can you hear me now?
Yes.
Is it better?
That's fine.
Is that better? Yes.
Yeah, it's fine. Just after the screen time. After the screen time.
Okay. So sleep and wake time should be consistent. Then the next one is avoiding stimulants. So towards evening, especially late evenings, avoid beverages like tea, coffee, avoid alcohol, or if you have to have it, absolutely in moderation, so that it's just enough to allow you to sleep. So avoiding stimulants, substance abuse is an absolute no-no. The next one is reducing screen time. We just mentioned that the blue screen is very, very bad for your eyes, very bad for your sleep, because it confuses your brain, and your brain thinks that it's daytime, so it becomes very, very active. So at least half an hour to 45 minutes before you actually get into bed, you must prepare the atmosphere. So your bedroom should be having a very, very low light when you get into bed. Of course, when you actually sleep, all the lights must be turned off, because melatonin is never secreted in light. There has to be complete darkness. So even a night lamp is an absolute no-no. So your room should be completely dark when you actually sleep. So reduce screen time, get into bed on time, about half an hour before your sleep. Try to make the atmosphere conducive. Those who have difficulty in following sleep could follow something like read for a little while. You could do some chanting or meditation, which also helps you to sleep. Or do something like a Sudoku puzzle, because that gets repetitive. Any activity which is repetitive will calm your mind and will allow you to sleep better. So don't just switch off your electronic devices for at least half an hour before you go get into bed. So music has a definitely a great effect on your sleep. And it has been proven now that music therapy is one of the big, very, very beneficial therapies in getting you good sound sleep. In Indian classical music, even Western classical, I'm sure would have a lot of notes which can help you to sleep better. Reading a simple, pleasant book, of course, and I said chanting, breathing exercises will also help you. This in yoga, pranayam, if you just do a little bit of pranayam before you get into bed, will also help you. And a very quiet sleep environment. Quiet is important. In some places, in some homes, they don't have the facility to have a very quiet environment. In such places, having some earplugs into your ear and having a mask, an iPad, an eye mask will definitely help you to sleep better. So these are some of the solutions to getting good sleep. And as we know that sleep is the golden chain that binds health and our bodies together. Without sleep, we will not be able to function. We would not be normal. We would not have normal relationships. We would not be productive in our work. So sleep is the key to a healthy life.
That's beautiful. The way I was reading that number of people who are taking prescription drugs has increased during COVID times.
Yes.
And and I think a lot of people maybe don't know effectiveness of how natural therapies can help, and that's why the prescription drugs are going up so much.
Very true. Very true.
We are open for questions. We are open for questions. I see quite a few people who are in Zoom, and then we are at live in FB as well. But we can take questions in Zoom. So anyone who has, I see questions coming up. All right, so someone is asking, I used to get very sound sleep earlier, but since COVID pandemic, My sleep is very disturbed. Also have a lot of weird dreams. Can you help? I think all of us are in the same boat right now.
Yes,
but
yes. Definitely, I think this is something that we really need to address because COVID has been an educator of sorts. It has brought so many things on the forefront which we never even realized would happen to us. And the psychological effects of COVID are so numerous that once the pandemic is going to be over, hoping that it will get over very soon. When it actually gets over, we are going to be grappling with the after effects of COVID. And the psychological effects would also mean that a lot of people will be coming with sleep disorders, which already they have started increasing the numbers. The reason why COVID is leading to this is the uncertainty, the unpredictability of COVID that has led to this fear psychosis. We are uncertain who's going to be next. Will it be me? Will it be my loved one? What is going to happen? Will I survive the pandemic? This is the key question today. Survival has become a major issue in COVID. So this is something that a lot of people have been going through. People with underlying anxiety or underlying depression who have been lonely to begin with are suffering from this more often than others. So people who have had a healthy lifestyle and a balanced lifestyle and a good immune system are much better off than those with underlying anxieties. So regarding this question is that you can, most important is that the infodemic, apart from the pandemic, the infodemic that we are all struggling with, all kinds of information through social media, through television, through newspapers, and every possible information site are actually increasing this fear psychosis. So try to limit your intake of news from various sources. Get into a set pattern of exercise, of daily routine, be proactive, be physically active, try and be a little socially responsible towards people who might be suffering from COVID. So then your fear will go away and probably you'll be able to sleep better. But if you are not able to, I'm confident that homeopathy could help you here.
Sure, sure. So we have a lot of questions coming up. So we have only 8 minutes. So thank you so much. But we have another question coming up. If I'm taking benzodiazepine, I think it's one of the drugs for sleeping. Yes. Can I drop it and clean my body? Question mark. Actually, I think someone who's take some kind of
benzodiazepine is one of the it's prescription medicines for insomnia. And it has been it has now been actually slightly outdated and used only in extreme conditions. Lesser anxiolytics and tranquilizers are being given out more often now. But if you're used to benzodiazepine, then I think you will need to work in tandem with your sleep specialist or your physician along with homeopathy. So once homeopathy starts working on you, you could definitely benefit from homeopathy. You could go to a homeopath, start the homeopathic medicine, and as you start getting better with your symptoms, then gradually with the help of your doctor, you could start reducing the dosage of your prescription drug. It can definitely work out, though whether we can eliminate it altogether is difficult because I still don't know your case very well. But you could consult an homeopath in your area and see whether they can help you about it.
Yeah, and if you wanted to consult Dr. Naik, you can email us, care@nourishtalk.com. You know, she has a lot of experience. We're happy to put you in touch with her as well. I just wanted to say that. All right, so we have another question asking, even after sleeping for more than 7 to 8 hours every night, yet get up feeling tired and unrefreshed. What could be the cause, and is there a homeopathy remedy? You know,
yes. Oh yes, this I guess a lot of people would also have this question. I did make a fleeting reference to this in my talk earlier.
Right.
That people think that just putting in those hours of sleep will guarantee them, will complete their sleep cycle, and that's normal. But as I said, that sleep is actually, the sleep cycle is divided into 4 parts. Most important is the first part, that is known as the non-REM, the non-rapid eye movement part, in which the first part is a very light sleep, when you can be aroused from sleep, you can be roused back to consciousness. And the second, third part, when you actually go into deep sleep. And if you're not allowing your body to go into these phases naturally, if any of these cycles gets interrupted or they're not being allowed to get completed, then you can suffer from sleep deprivation. So a person who actually sleeps at 3 a.m. after a party and gets up at 11 would get up feeling as if he has been sleep deprived, although he sleeps for 8 hours. So make sure that your sleep-wake cycle is absolutely regular. Half an hour, 45 minutes here and there is understandable and acceptable. But beyond that, a difference of 2 hours would set your circadian rhythm into complete disarray and give you a feeling as if you've been sleep deprived. And so you'll wake up feeling very tired and unrefreshed. Secondly, as I said, switching off electronic gadgets before your sleep hour is very important. A light physical activity towards evening, not vigorous, light physical activity like a walk, listening to music, a little bit of meditation, the correct diet, all these factors I just mentioned, and try and follow those, and perhaps you will start getting good sleep. And again, if it doesn't help, if it becomes something as a primary insomnia, then you definitely need to consult a homeopath.
Okay. Is there any homeopathic remedy for snoring? You mentioned about that in your talk as well.
Yes.
Snoring.
So snoring is often a part of what is known as sleep apnea. And there are several remedies in homeopathy which can help you. But if it is a lifestyle linked issue, for example, again, sedentary life, not enough irregular hours of sleep, bad diet, any kind of dependence on or addictions, these factors can definitely make you obese, or they can hamper your sleep cycle and cause something known as sleep apnea. Mechanical issues like, as I said, deviated septum. So these are again, it's a surgical cause. But sometimes there is none of these or mild factor, but the patient still has obstructive sleep apnea. And that's where homeopathy can help there. So snoring can be helped with. There are remedies like calibicromicum, especially if it's a sinusitis related thing. So any stuffiness of the nose or the air passage, which is hampering the breathing, calibicromicum is there. You have hepar sulfuricum, calcarea carbonicum. There are several remedies. Of course, you will have to see a homeopath because he or she will decide which is the remedy which suits you and your constitution the best. So it's individualized. So there's no offhand remedy for sleep apnea or for snoring.
Okay.
Yes.
We are pressed for time, and we are starting group workshops that I want to say that. And if all of you are interested, Dr. Naik can be there for 2 hours, and she can go into more details. So right now, these are educational sessions. Unfortunately, we are pressed for time. One more question we can take, and we'll have to wrap up today.
Yes.
So let us know, please. Okay. And then if you can't think of any questions, you are welcome to reach us at care@nourishtalk.com, and we will put you in touch with Dr. Naik. Okay, I don't see any other questions coming. So I think I'm going to wrap up this session right now. Please let us know your feedback about this session as well. Okay, I see someone raising their hand. Yes. Is it recorded? Yes, it is recorded. I see 2 people raising their hands. Please put it in chat, as because you can't talk. If you want to talk, I can allow you to talk. Any other questions? I see people raising their hands. I'm not sure what. I don't want to finish without understanding anything that we can take care of.
Is there somebody?
All right, people are raising their hands. I think they're saying they like the session and they want a group workshop. That's what I'm assuming. Okay. Well, thank you so much for everyone of being with us. Please let us know your feedback on our sessions. We have weekly sessions. Dr. Naik comes every month. If she has more time, I'll convince her to come more. But for now, she comes once a month on different topics. Excellent. That's one of the comments. Thanks, Dr. Sujata. Excellent. So thank you so much, Dr. Sujata, for being with us.
Thank you. Thank you very much, Amita. It was a pleasure as usual. Thank you. And have a great weekend.
Thank you. Thank you so much. Have a great day, everyone. Bye-bye.
Thank you. Thank you. Bye.